Every care home should present a safe environment for staff, residents and visitors. But good standards of health and safety do not just happen on their own. Safe systems of work have to be implemented. Staff have to be trained. Machinery and equipment have to be maintained in good working order. In other words, health and safety has to be managed, as with any other part of the business. Paying attention to health and safety is not only a legal requirement, it also makes good economic sense. Losing valuable staff through preventable injuries such as a fall on a slippery floor or back pain caused by poor lifting techniques costs the care industry millions of pounds every year. Risk assessments identify the risks to the health and safety of staff, residents and visitors and examine the best methods of eliminating or reducing those risks. In many cases, measures to control the risk can be obvious and easy to implement. Trivial hazards can usually be ignored, as can hazards with an extremely low likelihood of occurring. Some assessments may be simple and arise directly from observation, for example, if the lift door closes too quickly. Others may be more complex and could include things like staff training needs, type of equipment, how it's used and by whom, or building alterations to meet the needs of residents. The cooperation of all members of staff is important in the process of risk assessment. All staff must constantly be aware of potential hazards, which must be reported and controls implemented to reduce their risk. There are 5 steps to risk assessment. Step 1. Identify the hazards. Step 2. Identify who is at risk. Step 3. Evaluate the risks. Step 4. Record your findings. And Step 5. Review and revise the assessments. Step 1. Identify the hazards. The meaning of the term hazard is something with the potential to cause harm. This can include articles, substances, machines, methods of working, the working environment, and other aspects of work. The best way to identify hazards in your care home is to walk around the home and look for them. This may be achieved by either observation or consultation, and the best system will contain elements of both. Observation. Watch people at work and look for situations which could be potentially dangerous. Working practices often differ considerably from official procedures, so discreet observation may be required. Don't forget to take into account all non-routine operations such as maintenance, deliveries and emergency arrangements. Consultation.